One of the most common things that I get asked is how long is it going to be before I recover? And you can define recovery in a million different ways. I mean, there's some people say, when I'm going to go be able to go hike up Mount Shasta, go put my crampons and go climb Mount Shasta. Other people, recovery is defined as when they can walk out of, without a crutch. A typical hip replacement done in our ambulatory care center, for example, is up and walking the day of surgery. And people go, well, that's, appropriate. They use a walker and crutches, and that's true even in our hospital setting. We do a really good job of post-operative pain management, which makes that transition home a lot easier on that first day. And commonly people go, I'm going to do this outpatient, but I got stairs at home. And actually, we're going to make sure that people can do stairs before they can go home. I mean, that's one of our criteria. You got to be able to do a flight of stairs, even if you don't have any at home. So really, we want to make sure that that transition home is safe. What we typically find is that patients are on canes or crutches for about 2 weeks. The first 2 weeks are bumpy. There's swelling, there's pain. Typically pain isn't too bad. It's about 3 or 4 days of either mild opioid pain medication or round-the-clock Tylenol or anti-inflammatories. Now this is a spectrum. There are people that take a little longer. There are people that are a little faster. But the median time is about 2 weeks. Now at 2 weeks, typically people are starting to walk normally, but their recovery isn't done yet. I mean, they're still limping a little bit, maybe here and there. Maybe they're lacking still some range of motion. Maybe they're stiff. Maybe they can't walk very far. This is the role of physical therapy for my practice, is to try to hit those goals a little bit faster than our typical patient who doesn't go through therapy. And we find that if people attend to certain things like gait training, strengthening, and range of motion, they hit those goals pretty quickly. Typically, people are going back to driving around 4 weeks. Work similarly around 4 weeks. We've seen people go back sooner or later, but in general, these are the timeline for that kind of thing.